All right. Well, again, thank you very much for joining us today. See some of our community services staff that we have on. So we've got some specialists here, Christy and Isabella and Denise and Leah are here. And we've got our managers, Helen and Jordan and Michelle. And we've got some, let's see, we got our deaf and hard of hearing specialist, Rima, who is here as well. And we have our new HCBS specialist, who you'll get to meet, Alicia, here as well, too. Got some client services managers that are here. Thank you. And we've got, let's see, we got Phil on here from residential and Heidi always representing the greater foothills of Grass Valley area. And Shirley from our community services department. Good to see you here. Veronica from Woodland and Dana, as always, who attends these meetings every time. My assistant Zach is on. And I think I got most of you all. And of course, Reva is here, client advocate. And let's see, we got Tracy Brown, Associate Client Services Director. We got a bunch of folks on this morning. So welcome back. We're rolling into the new year here at Alta California Regional Center. Certainly has been a little bit of a challenge this week with all of the weather issues that individuals have had to put up with. I was hoping we might get Hewitt on here so we could get a little update on how things are going. But I certainly know that while folks were enjoying their holidays and time off, Tracy and our staff were making phone calls to people, making sure that people were safe from the storm and from the power outages and the flooding that has been going on. So I don't know that we have much to report as it relates to that, but if we do get Hewitt on at some point, maybe we can have him give a little bit more of an update of where we're at. One thing we do know is that there is a number of additional storms that are forecast in the very near future, which certainly could be impactful of individuals in low-lying areas, places that are prone to flooding, etc. So certainly want folks to continue to be safe. I will say that when the state of emergency was declared by the governor, I know a number of folks reached out to me directly. I'm sure folks reached out to their community services specialists as well, related to doing things like closing programming or not doing transportation during that day. The message that I give to folks is kind of the message that I always give, which is that you have to look at the safety of the individuals that we serve. First and foremost, the safety of yourselves and your staff that run your programs, that drive your vehicles. These are all considerations that need to be made in determining whether or not you're going to offer services on a certain day. And I think programs are still going to have to make that determination, transportation providers, service providers. What I will say is that there has not been any indication as of today from the Department of Developmental Services that they are going to fund for absences related to the state of emergency that was declared by the governor. What occurs typically is we get a notice, there's a state of emergency, whether it's an earthquake, fires, whatever else, and that can trigger the availability to do billing for the absences that may occur during that time frame. The Department of Developmental Services will put out a memo. It'll talk about the affected counties that it's impacting, and then we would share that with our service providers. So we're not saying that that's not forthcoming from the Department of Developmental Services. We have not received that guidance yet. We have not received guidance that they're going to do it. If we do receive it, you all will be the first ones to know. We will send out a message internally to our service coordinators and our case management staff, and then we will make sure that our service providers are aware of it as well, that they would have the ability to bill for any absences that may have occurred related to that state of emergency. Again, we have to wait until we have confirmation from the Department of Developmental Services about the ability to fund for that. Are there any questions related to that? Because I know people reached out to me. I know I had the opportunity to talk with folks on the phone about it in some cases, but any other questions as it relates to it? Again, I think that's the best guidance. I know Michelle's the one that oversees a lot of the day programs, here, but I think that's really the best guidance that we can give folks is look at the safety of the individuals. I thought DDS was required to fund for absences when there is a state of emergency. I don't know what the requirement aspect of it is. I know that they certainly do. I know that we've received memos about it, and maybe that's just one that we're waiting for. But again, at this time, it's not something that we at the regional center can say has been authorized by the Department of Developmental Services. And again, as soon as we hear from them, and perhaps that'll be before our provider advisory committee meeting next week. Maybe we will have heard from the Department of Developmental Services by then as it relates to this. But just wanted to share with folks that we don't have that guidance yet. And so we really cannot guide people and tell them to close things and give assurances that there will be funding for those days that are missed yet. We cannot do that. I'm going to go in the chat and just see if there's any other questions about that. Okay, perfect. And we do not have a second ASL interpreter on yet that I can make co-host, I don't believe. Okay, then I'm going to keep going until we do. So the next thing I wanted to touch on is, and I guess we just start about it and share with folks about transportation. I know there's as I scroll through, I know that not everyone that has their camera on is a transportation provider, but as I scroll on to pages 2 and page 3 of the folks that are logged in here, I certainly see transportation providers that are on here. So I can announce today that the Department of Developmental Services has in the works some type of alternative way to pay you beginning in the month of January. At our regional center, we just accomplished, or in the process of accomplishing, a huge activity of transferring all of our alternative services authorizations back to traditional authorizations. And what we learned from the Department of Developmental Services earlier this week is that they are now planning on offering what appears to be a different way for transportation providers to bill effective January, effective right now. That methodology, what that will be, whether it's a monthly rate, whether it looks similar to what the alternative services was before, we do not know. We do not have any specifics from the department. There is no directive that has come out. All we received is an email from the chief deputy director, Brian Winfield, who indicated that there has been a group of providers that have been discussing and, in essence, I think, articulating the issues that are around the rate study, rate development, and transportation. I think across the board, our transportation providers felt like the rate study would not provide them the compensation that would be needed to be able to provide ongoing services to our community. And these are huge concerns for us. And so what the department is looking at doing is putting in, again, some type of alternative way specifically for transportation providers to be paid. Again, there is not any specifics yet. Obviously, these are going to end up having to be retroactive authorizations, which is really an accounting nightmare for us. So again, as soon as we have additional information, we will let you know. As always, we will try to make whatever occurs as painless as possible to our service providers and to our service coordinators that are already having to redo tons of authorizations in order to initiate the new traditional services. So again, if we knew this was going to happen, if we knew that on the beginning of January, the department said that they would be creating a new type of billing methodology that would be effective the month of January, we might not have asked our service coordinators to switch over all of those authorizations. However, no one was aware of it. And so with that being said, I know we have at least Eric Champa from UCP, who is a part of the work group with the Department of Developmental Services that has been looking specifically at this fix. And you will all know as soon as possible. If you are a transportation provider, you're going to get an email today that outlines basically what I just shared with you. It's going to be a forward from the Chief Deputy Director at the Department of Developmental Services, letting you know that there's going to be some type of change to the way that you can bill that is allowing something beyond traditional services, and that it's going to be effective in January. So again, look out for an email today that's going to be going out. We will also, I don't want to send it too widely to our staff, honestly, until we have a better idea about what it looks like, because it's just so confusing, because we're already switching things around so much. I think I talked about it right before the holiday break about how we all need to be very patient with one another because of all of these changes that are going on. And now we have this little curveball that has been thrown to us as well. So just wanted to, let's see, I guess I can see, is there any questions from anyone related to this specifically? Again, I've really shared, I think, everything that we know so far, which is that a directive will come out. All right, let's see here. I want to talk about, we have for SLS vendors, I wanted to make sure that we had a very clear message, and I believe it went out in writing from Michelle or me to everyone last month, that in the month of January, the billing methodologies as it relates to SLS would not be changing, and that also the if there was some type of change that occurred to the billing for a supported living vendor or anyone that is involved in the rate study calculations, that there is that hold harmless date that exists until 2026. I think we have an upcoming vendor forum where we're going to explain a little bit more about this and give more opportunities for people to talk about the impact of the rate study as it relates to supported living. I certainly got a good discussion yesterday about the impacts of ILS. One of the issues, the biggest one that I'm kind of going to be vocal about with the department is the $16 an hour to be able to fund for ILS staff. That's what was calculated in the rate study, and that's really not bearing out as being what people are having to pay folks right now in order to do ILS services. And so that puts everyone in a situation where they're going to have, not necessarily losses per se, but the rate study is not going to be helping out a vast majority of those ILS vendors. We're going to look at it a little bit more, but for ILS vendors, I would be up for a discussion, and I guess supported living vendors, maybe a similar situation as well, about what your true costs are to hire your direct staff, and the disparity that exists between that and the $16.01 calculation that was put in the rate study. So anyways, with that being said, for SLS vendors, we will certainly talk about it a little bit more later this month. When is our SLS vendor forum, Michelle?
Sorry, my keyboard was muted as well. It's January 23rd from 10 to noon.
So January 23rd. We typically are always doing the vendor forums between 10 to 12. So, all right, thank you very much. Let's see, we have some changes to our community services department. And so, Helen, you've got some new staff, right? And so you can start with who you have on. And actually, I don't even know if we have your new staff on here today, but we can at least let folks know that we've got new staff.
Yeah, so Marty Eason, our community services specialist that handles transportation, DME, she's moving over to the transportation department as a transportation coordinator. And behind Marty, I hired Milton Guerrero Leon. He goes by Danny, and he replaced Marty. And I think Adriana, the group has already met Adriana, Morgia, and Maurice Connor as the new early start specialist. That's who I have right now.
Helen's got a little refresh of staff in the in that side of community services, and so very excited as we get new people on, and especially as we're looking at trying to expand things on the early start side when it comes to service providers. Certainly going to need to have those bodies in community services to process things like those vendorizations that we're doing. And Michelle.
Yeah, thanks, John. So I have Alicia Gauchi. She is our new HCBS specialist, and she'll be giving you guys an update on that in a little while. And I also have Leah Mosier. She is our specialist that has taken over, and she is working on ILS and residential.
Awesome. And we'll have Alicia go now. What's going on with what's going on with HCBS?
A lot. So we are only 10 weeks out from the final rule at this point, from today's date taking effect. We still have 491 providers who aren't in compliance. And 122 of those have not responded to any or provided any documentation at all. So we are working hard to get as many people in here as we can, providing workshops. Our next workshop is going to be January 19th, where we'll have specialists available to help providers who need support with making sure that they're in compliance with the final rule. And we will also be holding 2 vendor forums, one for residential and one for non-residential, since the requirements are a little bit different, the week of January 23rd. And those dates should be set in stone today. I'm going through line by line of people who are not in compliance. A lot of people submitted stuff over the summer that it looks like DDS reviewed, and then the homes or programs were not updated after that, letting them know what needed to be fixed. So I'm going through and notifying providers one at a time, letting them know what needs to be done for them to be in compliance, as well as sending reminder emails to those who have not submitted anything.
Alicia, I'm
So-
going to put the email for the HCBS inbox. If you guys do have questions or just want to know where you stand as far as compliance, go ahead and provide
Yeah.
your vendor name and number, and I'll put that in the chat right now.
Perfect. Yeah. And I'm pretty caught up on the HCBS inbox. So when you send it, I'll see it right away and I can respond and let you know what you're missing. But otherwise, I'll be working through it alphabetically.
All right, excellent. Thank you very much. So again, Alicia Alicia, taking over HCBS is a certainly requires a little bit of understanding about our regional center. Can you just let folks know a little bit about where you were at before you came to community services?
Yeah, right before community services, I was working a children's caseload based in the Placerville office. And before that, I was running residential programs in Grass Valley. And even before that, I was running stabilization and crisis unit homes in the state of Oregon. So the EBSHs, I was managing those.
So you're saying that you got a little bit of an idea of how to help guide residential providers through this HCBS process?
Yes, and I understand all the challenges that come with running a home with some pretty intense support needs.
Well, and Denise and Odelia and others that were involved in our vendor forums kind of in the beginning with the residential providers and the kind of freaking out that went on as it related to whether or not we were going to be able to implement some of these things. And I think over the years now at this point, for the most part, people have come to realize that it's certainly doable and it's adaptable to the different homes that we have. But we just need to get this pushed past the finish line, folks. We need to ensure that we get all of these in. I suppose I can talk about this maybe more next time, but I think full disclosure wise, and because some of you may be aware of it already, is that the state of California has entered into a corrective action plan for their HCBS compliance with the feds. And what that means is very little for providers. We still expect providers to get all of their information in by the current due dates that are available, but there is a corrective action plan that the state has put out. It's on Department of Healthcare Services website, and we can certainly take a look at it if this service providers feel like they want to. We can certainly talk about it during the Provider Advisory Committee meeting as well. But again, it doesn't change on the ground what the expectations are, which is that we get all of these reviewed and that we get all of the plans in place so that when we're serving our individuals, we're doing it in such a way so that the HCBS guidelines are being followed. So thank you very much for that update. I appreciate everyone doing these hands-on meetings. Again, I think in trying to understand some of these things, I know when I've gone into the conference room and talked to vendors, they've been very appreciative of having someone that's willing to sit down and go over it specifically with them and made it a process a little bit easier. So I think that was a great idea. And we'll keep going from there as far as getting everyone in compliance. Let's see. There's been questions and I know that we're going to be discussing it at our Provider Advisory Committee meeting next week. And the Provider Advisory Committee is next Thursday, related to remote services and Taylor Day services. Like, what is Taylor Day services being, implemented? How many people have indicated that they want to do that? And so we're going to be gathering that information to report to our provider advisory committee on Thursday of next week, and then we will have that information for those that don't attend that meeting. We'll have that information to share with folks on Friday. I don't know, anecdotally, Shirley and others, are you continuing to hear from service providers that they're interested in doing tailored day services?
Sorry, that was a yes.
Oh, excellent. Now, would you say there's been a few of them? Have you, or do we have a lot, or?
A few more. I think there's a few more. We've had a few programs add that. I think was a little bit of confusion, honestly, between the addendums we were asking people to do and what TDS is, because I actually received some addendums that were titled TDS. So still working through that. I think there was a little bit of confusion as to what the addendums, meaning the addendums for remote services for this year. So anyway, but we do have a few more. Some have been current programs that have been with us for a long time, and several of our newer programs have added TDS. So probably 5 or 6 more, at least.
And I understand we had a meeting, was that earlier this week, where we had a little bit of technical difficulties as related to supporting folks about tailored day services and remote services and things like that. Michelle, can you kind of describe the meeting, or if one of our people from our provider advisory committee meeting or is here to describe it? I think it's going to be you, Michelle.
Okay. Yeah, so the provider advisory committee and Alta Regional just kind of met with vendors to counsel and have a collaboration on just kind of reimagining services now that we're transitioning out of the alternate services and into remote, and what that kind of looks like, and just kind of collaborating with other vendors as well. And when Carly could not make it to this meeting, but I did chat with her. We currently have 8 vendors since the regulation changed for TDS, and we have several in process as well.
Excellent. Thank you very much. In the same vein, we've certainly had feedback from service providers about, well, the Department of Developmental Services is making this apparently as easy as possible to initiate tailored day services. They really try to streamline things. What at the regional center are you willing to do? So just to share with folks, we're also looking at our own internal processes on how we guide our service coordinators, and we are looking at ways of streamlining that process. And so once we have, I think, the message ready to send out to our staff about it, we will share with our service providers kind of what we're planning on doing to streamline that referral process on our side at the regional center as it relates to the tailored day services. So I think we got the thumbs up from Michelle this morning about it, but we'll make sure that we've got the documentation, and we'll share with you all probably next week about the little change that we're planning on doing as it relates to authorizing tailored day services. Vendor forum wise, we do have the EBSH CCH, so the Enhanced Behavioral Support Home, Community Crisis Home vendor forum is coming up. Let's see, that is in March, I think, Jordan, right? You got that in March?
No, the EBSH CCH vendor forum.
Oh, excuse me, January 26th.
Yeah.
Okay.
And that'll be from 10 to noon here at the regional center.
Yes. Carol Watillo has a hand up, and I'm going to guess that it's not about the EBSH CCH vendor forum, but possibly about tailored day services authorizations. Carol Watillo.
Well, it could be about the other too, because yeah, but thank you. The streamlining, and I was able to talk to Michelle about that a little bit at that forum that we had earlier, but wanted to just check with the folks switching over from alternatives, especially, but other folks as well, because of this backlog with the TDS referral and the committee thing, we're having some folks now who are getting stuck in that, then not being able to have services for 2 weeks because of the accounting department 2 week in, so we've waited and waited for the purchase to be able to go to committee. And then we're now waiting 2 more weeks for it. And that just feels difficult for the people especially the people coming off alternative services? Is there any flexibility there? I know that it is possible. I just don't know how like cumbersome that would be, like what the numbers are for the regional center as it would relate to that.
John, can I
I
speak?
saw.
to
I was
that?
going to say I saw Tracy unmute, and I saw Michelle get closer to her monitor. So,
Oh.
please go ahead, Tracy.
You want me to take that one? Because yes, we have a solution, Carol. And we definitely understand the impact that committees have sometimes on the process. And so again, because TDS is new, with the new way of implementing TDS and it broadening, it definitely, TDS has always been something that we have had on the committee. So we are actually going to be removing that from the committee process. Managers will have a kind of a checklist of what needs to be outlined for the service coordinator to review with them. And then they will make sure that it's fairly short checklist. Of course, it includes having the what we are referring to as the ISD, the individual service design that the vendors are required. So making sure that is available, making sure the service coordinator has an addendum outlining with the client specifically what the service delivery is that they will be receiving. And then managers will be able to then review that directly with the service coordinator, and then the POSs will go in. The POSs will be approved immediately by us to be implemented, so there won't be that 2-week time frame. Now, unless of course, if a client is starting February 1st, so then it will just go through like a normal typical POS. But we will be looking at those on an individual basis to make sure we can streamline that process and get these services in place.
Tracy, that's excellent news. So we have a couple people that are like right there in that little window and got notified that they would be able to that the TDS purchase was approved, but that it's the 2-week notice. So you'll be able to get back to those people and let them know that they can put those POSs in right away.
If I were to know who those people were.
Yes, Michelle.
But-
Michelle knows those people, so
Okay,
that would be
those
Yeah,
are
excellent.
on
Tracy,
email
I can forward you that email.
I just got the email. My boss, Michelle, sent it to me.
Oh,
And I
okay.
you guys, this is all hot off the press. This
Yes.
was all something that we came last night and this morning because we recognized, amongst everybody that this process is being impacted. So I have to apologize a little bit to my managers because there's a couple on here that know, but a couple that don't know this information. So you guys are all getting this hot off the press. I'm emailing the checklist and everything out today to my managers. Yeah, Heidi was one of them because she emailed me and said, my SC can't get into committee until February. That's not going to work. And I said, well, here's what we're going to do. So everybody was advocating for this.
So yeah, we
Yep,
just
I
want
will
to thank.
take care of your two, Carol, also on your list.
Thanks. We just want to thank the Regional Center for just like really recognizing the impact that was having on individuals and just listening and collaborating, and really, really appreciate your team. So thank you very much.
All right, excellent. So yes, that is what the plan is. We're gonna no longer have those be required to go through, but on our end, operationalizing it, we have to, as Tracy said, we got to update our quick reference guide and all these other documents that we have, and we'll update it out to our managers. But I think everyone is about streamlining things right now when we have so many different things that are going on that need to be implemented quickly. And again, the department streamlined a lot of these things. And we cannot be the internal, our barriers causing those delays. So, Dennis, hand up. Yes, sir. You're muted though.
Always. I wasn't able to make the meeting this week, but I had been told that now TDS will not be able to use one of the remote services of being able to have phone conversations with the TDS participants. That was taken out of the remotes. Is that taken out for everybody, or was it just TDS?
Shouldn't have been. The remote means computer or telephone, the way it's
Yeah,
defined.
okay.
So,
I feel better. Thank you.
but let me touch on that. Let me touch on that just a little bit, and some things that we kind of heard and saw over this last week, which is, we cannot have it be dictated to our clients that they must do phone calls with you guys or that they must do a Zoom meeting with you all. At this point, we're not doing alternative services anymore, and we're not doing it based off of what the staffing ability of the program is. Like, we have to do this off of what the clients are specifically wanting and asking for. And so I had some emails come to me this week that were like not fantastic to read from different service providers. And I believe we've cleared up the situations. A lot of people just kind of misunderstanding kind of what we can and should do. But Michelle brought up a good point this morning that we talked about, and I want to make sure we discuss it here as well, related to billing for people that just show up for a little bit. If you bill for that full day for an individual that shows up and you don't have the staff there, then when you go to calculate your total monthly staffing hours and you go to look at the total number of hours that you're supposed to provide to the clients and the ratio, you're not going to have enough staffing hours to justify it if you're billing for those full days for people that are just showing up and leaving, if you're out of ratio. So if anyone has that in their plan or something like that, please, as same people, the idea of having a morning shift and an afternoon shift of like clients coming in so that you can serve like more clients in 2 days or 3 days than maybe a full week. Again, if your billing is keyed off of a full day's worth of billing, if you're a daily rate vendor, then we have concerns that you are going to not be able to meet your staffing ratios. And we'd love to meet with you and go through the regulations and also go through our math, because it really is at that point kind of proceeding at your own risk in situations like this. Again, the planning teams, the service coordinators, are really looking critically at these things. They've been asked to do that by the managers, by our directors of client services, the ADs as well, that we have a again, really client-focused decision that's being made about the type and amount of day programming services or tailored day services that are being offered. So just wanted to kind of put that out there. I think when we talked about this last time, it's like, yes, but then we also have this overwhelmingly huge staffing issue that's going on as well with our service providers. But again, I just want to be mindful of things that people might be trying to do to be able to get some billing for that full day that might put them in a situation where they again have they don't have the documentation to show that they had enough staff on to be able to meet the ratio for the day that they're billing for service. So again, probably not something that we would want to talk in a big broad group about. If you are someone that's interested in doing that, we really want you to contact your specialist. I know some of you have already reached out to Shirley about it, but contact your specialist. Let's get a meeting going. Let's all get on the same page. Let's start off 2023 like where we are providing the best guidance to you all, and also we can help understand these letters and things that are going out to service coordinators about and clients and families about partial program closures and things like that. So again, just want to encourage folks to please reach out to the specialists. And I will just tell you, I continue to be concerned about the ability for us to provide all of the transportation that's going on right now as well, trying to rebuild all the routes and things. We know there's just an immense amount of that. And so I don't know how that's going to be impacted by the fact that we now have what appears to be a new opportunity for some type of alternative billing to occur for transportation providers. All right, that was a lot, but it was definitely stuff that we discussed this morning, and I wanted to make sure that folks just know, please come talk to us. Please schedule a meeting with us so that we can go over these things with you, and we make sure that we can get email the department together and find out if we need clarification from the department as well. So, all right, I'm going to jump over the chat. The PowerPoint on the remote services TDS presentation earlier this week said that we could no longer do phone check-in as a remote service. Yeah, well, yeah, no. Yeah, let's be clear about that. Just calling up someone and being like, hey, how's it going? Like, that's not providing the service that you guys are vendored for. Right. That's not providing, like if we're talking about remote services. So That's not delivering a service to our clients, checking in with them and being able to bill for, like, for example, a full day of service for that day. Again, that's talking about like alternative services, and that's not what we're doing anymore. The ratios need to match. The programming needs to be very similar to what was offered. Carol, is your hand back up? I think it is.
It is.
All right, go ahead. Yes.
Well, maybe just to add to that, like, for example, for us, how it would look different for remote versus alternative. Maybe we're calling somebody at work and walking them through their check-in process at work, their how to clock in, because they need a little bit of kind of verbal walkthrough with that, or we're doing it on FaceTime. Then we're going to bill for that 15-minute increment that we supported them with that thing. We're not going to bill for the alternative services, 60% of our monthly billing for that 15-minute call. So that's maybe the difference, if that's accurate, John.
Well, and yeah, just that alternative services are gone now. There is no,
Right.
so anything that's being done, it really does need to be very similar to what is described in it. Again, so if it's
Time for time.
specifically, yeah, if it's specifically working with the client, related to it, that's a different story. But just calling in, hey, you have everything that you need today. That's not a day program service. That's not an employment service. And so just want to be mindful that in situations like that, we're going to be really critical in taking a look at it, I think. And I think our service coordinators have been directed to do so. Andrea, and then, oh, sorry, go ahead. Carol.
Sorry. And then I think the other piece of that is just that that's going to affect daily rate providers much more substantially than hourly rate providers, because you have to provide the full amount of time to be able to bill for it. And then the other question I just had is just with the change, so COVID pay, the reimbursement or theoretical reimbursement for COVID pay for employees has gone away now as of January 1. And yet we are still mandated to have those staff who test positive off work. That is just gonna, I don't know how many other people, I assume all of us are like looking at that really critically, and the cost of that, and what is gonna happen, not just in the cost of to the employees, like we're gonna lose people because they don't have enough sick leave. We can't pay them for that time because we don't have extra dough just hanging around to pay them for time that they're not working. And then you counter that also with the immense amount of lost billing that's causing. I just don't know if we're really recognizing how immense this is going to be, and what we can do about it, or if anybody knows if the regulations on one side or the other of that is going to change.
Thank you, Carol. Yeah, again, these are all things that we need to be very mindful of, is the ongoing impact to the service providers and the fiscal impact of having to, provide that time off and not having the compensation that corresponds with it if you can't run your programs and bill. Andrea Kroom.
Okay, I kind of forgot my question, but so I think it had to do with something. So with the movement to remote services, there was still something out to saying that we would have to somehow document or something when things were done remotely. That is not a very solid question.
We're still waiting for the additional guidance from the department about how things are supposed to be documented. It has not come out yet.
Yeah, so the concern with that is then it'll tell us in March, and then are we supposed to go back to January to document 200 plus people that may or may not have had remote service to look back through somewhere?
But yes, that is what all of our concerns are when we make things retroactive like this. And yeah, so yes, that is certainly a concern, and I wish that we had an easy answer from the department, because this is not. It's just like a sheet of paper that they need to send out to folks that indicates, put the numbers in, or an Excel spreadsheet. It shouldn't be the most challenging thing in the whole wide world, but I think we'll see what they put out, and then we'll do our very best to help support our vendors in being able to gather that information. It's not, I don't know how dissimilar it is than doing a DSP survey that everyone got paid $8,000 to do, but based off of data that most companies don't necessarily track the way that it was requested for it to be delivered to the survey. So again, we'll see what that impact is once they put out the form for it. But right now we do not have that information. In the chat, a comment from Dennis there about the rebuilding of the transportation routes and that there's still a lag in the authorizations being put in place to be able to get some of these things going. Again, we did have a turnover of our transportation coordinators over the holidays as well. Silas Brock is no longer with Alta California Regional Center, and we've moved Marty, which is nice because Marty already has a deep understanding and a relationship with a bunch of the transportation providers, and now she's over in that role as a transportation coordinator as well. Let me see in the chat here. Will we still have to report remote services if we have added them into our program design? There's something, because there's no way to keep track of it, for example, like the authorizations still look the same. Like whether you're doing remote services or whether you're doing in-person services, the authorizations all look the same. So I think the department wants some way for us to be able to keep track of the number of hours and those types of things. We just don't know specifically what that's going to look like, what that tracking will be. And maybe they'll decide they don't want to track it. I don't know, but we don't have that guidance quite yet. Andrea?
Sorry, one more question.
Yeah.
Kind of going back to the switch over of purchase of service for alternative to traditional. We're not changing any of our day program stuff to TDS because we already have it. But I know that some of my directors are having some difficulties of getting POSs in a traditional way correctly because we are an hourly billing also. So it's, especially for newer service coordinators, it might be extra confusing. So just putting that out there. Hopefully we can rectify and retro pay from January just in case. So
Again, I think in a situation like this where we're trying to wholesale, change things over, and again, we still don't know what's going to go on with transportation purchases for this month, there has to be an expectation that there's going to be an allowance for some retroactive purchases based off of delays in authorization and things like that for services. The main thing is ensuring you've had those planning team discussions, making sure that there's very clear communication amongst the planning team, including the service coordinator, about what's going on, and then we'll go from there. But I do want to just put in that comment from the chat, the comment there that we believe that there is going to be a recording requirement for the for those remote services, though we just don't know exactly what it's going to look like. So let's see here. I want to share my screen real quickly with folks because I want to mention that our newsletter is out, and hopefully folks have had an opportunity to take a look at it. Are you guys seeing Alta's website there on the front page? Yep. All right. And you guys see Alta Connections down here halfway through. And if you can see all the different languages that we have for our newsletter, this is the newest newsletter. And then we have the additional newsletters from previous quarters. And here's our English version of our newsletter. And this is our featured artisan was Matt Duff Kelly, and showing his hot chocolate bombs that he makes, and he was selling them at one of our the Micro Enterprise Fair, and we felt like it'd be a great idea to feature him and the work that he's done. Newsletter's a little bit longer this time around than it was previously. A lot going on at the regional center. Great discussion here from Lori talking about our performance contract and our strategic plan. Certainly gets into the discussion about the activities that we've done to promote housing in our area. So lots of good information in here. She does talk about some of the things that we are requesting from the Department of Developmental Services, which is new multifamily housing development projects in Woodland and Lake of the Pines, just south there of Grass Valley. And also that we are looking at adding a housing navigator position to our regional center as well. So we've put funding requests into the department about that, and we're hoping to hear more about it soon. You can see information about our Micro Enterprise Fair. You can learn about our new dental coordinator. I had a great meeting with her this week. We're looking at transitioning over from a system where we have committees of individuals that are reviewing dental needs, working on prioritizing things, referrals, things like that, authorizing services, and we're switching it over to a dental coordinator that is going to be hopefully able to streamline these things, and also definitely speaks the dental language much better as a dental hygienist than us as regional center staff. So additionally, we have an article in here about some work being done with CAPTAIN, which is the California Autism Professional Training and Information Network. More information in here as well about advanced care planning and some of our activities, outreach activities that are going on. And let's see. Oh, I don't want to click on this link, but well, hopefully you guys can all click on this link and take a look at it. But this is the link directly that you can look at to watch the Client Advisory Committee. They did an awesome, with Future Films, they did an awesome, very short video on YouTube that describes, their interest and what home means to them and being able to live out independently. We have a great client profile that is here. Our case management staff always do a great job identifying someone. We've got a little, pictures here of the Dream Theater folks participating in the holiday parade that was in Roseville. Luckily, we were able to get this all in. An update on our coordinated future planning initiative. And then one thing I wanted to touch bases with everyone about is our Disability Housing Alliance. And so originally we had been talking about this as our Housing Action Committee, that Alta California Regional Center was looking at developing a Housing Action Committee that basically can help the regional center in finding out opportunities for affordable housing within our 10-county area. We're so huge. And so over a period of months, I have been working and discussing this with different folks, and Future for Our Kids, which is a parent group out of Placer County, has decided to serve as kind of like the lead group as it relates to these activities. And the goals of this group are to establish a group of parents and others to be local advocates for housing development, to cultivate community allies, champions, including local officials, planning commissions, service organizations, and others, and to encourage development of housing that is affordable, supportive, and the choice of individuals. So we've got folks from State Council on Developmental Disabilities, we've got parents on here, got residential provider on here, we've got Housing Now with Patty Uplinger on here, we've got a board member from the ARC of California. So we've got some very involved folks that are interested in supporting these activities of our regional center. I'm meeting with these people once a month. And one of the results of the meeting that we just had is that we're going to be meeting with the developer related to a project in Rockland that we think that we might be able to get some political support for. So anyways, more to come about the activities, but there is, I think, a lot of room for service providers to be part of this group, especially, for example, those that are interested in housing things like our residential providers, our supported living providers, etc. So we're meeting monthly as a group, and then working on kind of what the real activities are going to be. So, for example, when we have a housing developer that wants to develop something in Woodland, we are creating a list of different members of this group that can be activated when we have something that goes on, for example, in Yolo County. So if Yolo County has a request for proposal out there and we have and there's a public meeting that's going to be about it, we might invite some of the family members or service providers or advocates that are part of this group to come give public testimony, for example. So what this group is doing right now is kind of educating themselves on how to do that advocacy at a kind of a political level as it relates to finding more opportunities for housing for people with developmental disabilities. So stay tuned. I'll talk with you more about different activities that these folks are doing, but in our newsletter, you can get a little information about them. And then I know Future for Our Kids is getting ready to put more of the information on their website as well, so you can learn more about the activities that we're doing. And again, State Council has always been a great partner of ours, and they definitely are very excited about any opportunities that we can have to enhance more affordable housing for people with developmental disabilities. Next section is our resource development update. So big chunk of different things that are described in here. Always nice to see, something like Dolphin Swim School getting a vendor, things like the social rec vendors. So I think one of the things that we're looking at here in the next, at least soon, is trying to have a spot on our website that shows all just the social recreation vendors, because there's so many different vendors, like so many different vendor categories that social recreation can fall under. And so I think as Helen's team kind of continues to vendor more and more of these types of vendors, we want to have a very good list of here's kind of what we have out there, so that hopefully rather than doing 1,000,001, purchase reimbursements and as we call service code 024 purchase reimbursements, that we can maybe start directing people towards some of these vendored resources instead in folks' local areas. Again, it's just a process getting everyone vendored, but we did get some great guidance from the Department of Developmental Services about the social recreation vendorizations, that we should look at being able to basically fund things like membership activities and things that need to be funded up front. And so that's some of the stuff that's Helen's team is reaching back out to vendors and trying to get them on board with, because it's been a challenge getting social recreation vendors able to align their billing practices with the regional centers. And so the guidance we got from the department is, hey, regional centers, you need to figure out how to align your billing practices with that resource instead. So I think that part of that means doing more frequent check runs as well to those types of providers. The next thing was all the information that we shared with you folks related to the day programs, independent living services and employment services and tailored day services. So they're both the remote services and tailored day services. And this just shows where to look at this information for folks and recommends that people review these directives that came out from the department at the beginning of December and the end of November. Additionally, we had some closed service providers. Certainly one of them that sticks out right there is MedStar, because of the impact that had throughout our catchment area. Kind of still is having an impact as we look at rebuilding those transportation routes. We have the next feature. I saw Phil on here. Phil, we don't have Maulette on here, but can you explain what this is all about?
Yeah, sure. This is Mahalette. She's a newer service coordinator, but she's in my unit on my team, and she's wonderful. She did this. This is at one of our unit meetings. She did a sort of like a coffee ceremony for our team, and it's just a way to build our team and kind of and learn about some of her culture. She's from Ethiopia, and Ethiopia is the birthplace of coffee. So she shared a little bit about the history and kind of about how important it is just culturally to sit together and get to know each other and have coffee together. And so we did it as a team, and it was just a wonderful team building event that we did, and amazing coffee too. She brought some Ethiopian coffee for us to share. So, and I love coffee, so I was happy.
She messaged me yesterday saying that I can get an invite to the next coffee that she does. So I'm very excited about this.
We're going to do one in March. We'll let you know.
Yeah, again, wanting to feature our staff and just the fantastic things that they do for each other. Like, again, that was, and we really notice it, as things are getting back together and we're not all working remotely and people are spending time together in the office. It's great, especially when we have our newer staff that are willing to open up and share about themselves and their culture. And again, I'm very happy to do it. And the pictures came out fantastic. So thank you very much, Phil, for giving that information that we can share with folks. And then Lindsay gave us an updated information here about the Provider Advisory Committee, and just want to, encourage folks. We always, have, 80, 90 people that are in these meetings, and we might get, a third of that in our Provider Advisory Committee meetings. And those are just really important to be able to get updates and understand things. So just want to encourage folks to do that. And the article there. There's just showing you we're at right around, well, it shows about right around 28,000. We're actually at quite a bit more of that because of all the people that are in intake as well. So we're serving just a huge number of individuals. We're growing and growing. We had a fantastic Santa Day. Our Santa committee did an amazing job this year. I appreciated folks that, sent some pictures in, and just really, really fantastic time. First time back in our office in 3 years or so, I think, doing the Santa Days. So again, just really want to appreciate our service providers that came in, that participated in it. Certainly want all of our staff that have been planning this for months and months and months, and folks that spent their time there in the building to do it. And then finally, this is as we like to do, we like to promote our typically it's artists, and this time we chose an artisan. And this is that small business that Matthew has. So definitely want to encourage folks to, take a look at what he has to offer there, and you can check out his website, or excuse me, on Instagram is where he can be found. So want folks to take a look at the newsletter if you get a chance. Again, lots of good information in there. You can find it right on the front page of our website. And if you are signed up to get emails from us, it's 12 o'clock. Let's see, Michelle, do we have anything, Johnson? Let's see, Michelle Johnson, anything from case management that we need to share today right now? Are we good?
We're good, John. Thanks.
All right. Excellent. Well, I will look forward to talking to everyone next week. Please get in contact with your specialist if you have any questions or need anything specific related to remote services, tailored day services, etc. And we'll talk to everyone, as I said, next week. Happy New Year, as Carol and others have put in the chat as well. All right, take care.